Hello everybody and welcome to this Agenda for Change Systems Learning Exchange event on strengthening WASH systems, the new normal. My name is Tracy Keatman and I'm supporting Agenda for Change with the facilitation of the discussion today, where we'll be exploring how our initial responses to COVID-19 are adapting as the crisis continues and how we're connecting with specific systems learning strengthening work. This is the second discussion in the Systems Learning Exchange series and builds on the first one, which we held in June on WASH systems and emergency response. If you've not seen it, you can see the video of that webinar on YouTube. And so this exchange really is all about peer exchange, and we're aiming to encourage conversations and learning amongst Agenda for Change members and countries. And today, to highlight that, we've got 24 countries online or hoping to join us online today, with about 63, 65 people online. So thank you all again for joining us. So on the next slide, you should be able to see, if Susan, you can change that to the next one. You should be able to see our agenda for the day today. After a few more introductions, you'll be hearing from Susan Davis, who's the Global Coordinator of Agenda for Change, to give a background on the organisation. And we'll then turn to each of our speakers for a quick recap on their video presentations that they recorded for us prior to this event. We'll have a panel discussion before we'll then hear from Alec, also from Agenda for Change, to hear about your feedback and on the next steps and next themes. So on the next slide, you'll be able to see actually who's who today. So obviously there's me, I've introduced myself, I'm Tracy, I'm an independent consultant, I'm supporting the facilitation of today's event. There's Susan and Alec from Agenda for Change, as I mentioned, also William, who is working with them. We've got Yogesh from Helvetas, Nepal, Martín Rivera from Honduras, Kate from Uganda, and Avo and Rodolphe from Madagascar. So you'll be hearing from all of them as the session goes by. Hopefully you can see them on the videos as well, and maybe smile and wave, they'll wave at you. So first of all, I'm going to hand over to Susan to tell us a little bit more about Agenda for Change. Thank you, Susan.
Hello, everybody. I'm just figuring out how to show slides and share the screen at the same time, so apologies for the awkwardness, but Agenda for Change is a global collaboration of like-minded organizations. Currently, we have 14 members that you can see here, and all of these organizations believe that to reach SDG 6, we need to work together on what we call system strengthening. So that's strengthening the local actors and factors that make WASH and WASH services last forever. We, as a collaboration, are working on this system strengthening approach in more than 40 countries. As you can see, all of these countries that are colored here. We are also, in this year, in 2020, supporting collaboration among Agenda for Change members in 10 countries. You can see the blue ones highlighted here as well. So we're really excited about that effort and helping you all get to know each other and work more closely together in those 10 countries. And our key activities for the past 5 years, and especially now in 2020, are working to compile evidence. What does it take to make a stronger system? Are we making changes that we think we're making? And we have just hired a consultant, and some of you might be asked for data to share for that. We are working on collective advocacy in different ways, sort of a matchmaking approach where we will help organizations that are trying to make change in, for example, foundations or with governments or with big organizations like UNICEF, so that we can work together to help have a common voice. We're also working on knowledge sharing. sharing and learning, and we're really trying to help you all talk to each other in better ways. And this set of webinars, this learning series, is one example of that. We're trying to get better at using different languages and using different platforms as well, instead of just creating some documents to put on a website. So we look forward to hearing from you on what you find useful. And I believe that is all from me. Thanks, Tracy.
Great, thank you so much, Susan. Okay, I think you can stop sharing screen as well now, and then we can see, hopefully, or the audience can see all of our speakers as well, or the majority of our speakers. I think some may have a little trouble with the video, but hopefully most of you can see most of us. Okay, so next I'd like to invite our speakers, one after the next, to introduce themselves a little bit more and to describe, just in 2 minutes each, the key points from their video presentation. Hopefully you've all had an opportunity to watch the videos that Alex shared on YouTube. So we won't be watching those videos here today, but you will have a 2-minute recap or an overview of those key points. What we'll do next then is go to Avo and Rodolphe, who can share their 2 minutes, telling us about how they've been promoting WASH systems approaches for sustainable inclusive services during COVID-19 in Madagascar. So over to you, Rodolphe, and or Avo, whoever would like to start. Please tell us in 2 minutes a quick recap on your video. Thank you.
Bonjour, bonjour tout le monde.
Hello everyone. My name is Rodolphe. I am a senior advisor for Project WASH, and I belong to WaterAid. And I'm going to talk about my video and do my presentation. Yes. Hello everybody. Well, everybody. So my name is Avo Ratoarijaona. I am the deputy from Rajan WASH, Madagascar, which is financed by USAID. And Rana WASH is a project that was implemented or is implemented by 5 organizations, 3 of which are international. There's CARE International, CRS, and WaterAid. And then there are 2 private sector members. And Run WASH contributes to the construction of a WASH system, a strong system in Madagascar, to realize its objectives to improve service delivery, WASH service delivery. And in this case, we have already presented with our, during our presentation, within the COVID situation, how the WASH system functions and how it has been strengthened to work within this COVID situation. Of course, we need to continue reinforcing it and to find the appropriate team to do that. So today we are very pleased to be able to answer the questions that will be posed, and then also to seize this opportunity to have exchanges with you. Thank you so much.
Great, thank you so much, Avo. And Rodolphe, did you have anything else to add, or we can move on to the next one? Okay. Rodolphe, did you want to add anything additional?
Non, merci. On peut avancer.
No, thank you. We can move ahead. I will participate a little bit further when it's a question and answer session.
Great, thank you so much. So next I will come to Kate, for you, Kate, to tell us a little bit in 2 minutes about your video presentation, which was on the role of stakeholder coordination in addressing emerging WASH problems in the Kamwenge district in Uganda. So please take the mic, Kate, and give us your 2 minutes overview of your key points. Thank you.
Thank you very much. Hi everyone. Yeah, my video did present a case in Uganda of one district local government, that is Kamwenge. In Kamwenge, that is where Water for People is implementing its Everyone Forever program our work focuses a lot on system strengthening, working definitely with the government. But they did showcase a lot of good work that had been done before. They did demonstrate how bringing stakeholders together under the leadership of government builds trust over time, and they can actually overcome challenges like the COVID pandemic. So they were able to do quite a number of things together with the CSOs, the private sector, and they were able to serve, continue serving the people of Kamwenge, diligently. Thank you.
Thank you, Kate. That's perfect. And next, I'd like to ask Martín to tell us a little bit more about the presentation he gave us, which was about the networking approach and the trigger for the WASH response to COVID-19 in Honduras. Martín, would you like to take the mic next? Thank you.
Hola, buenos días.
Hello, good morning. Thank you for inviting me to this event. I am Martín Rivera. I am the coordinator of the movement Everyone Forever in Honduras. We are a network of 16 organizations from the government, NGOs, and the academia. And we collaborate together, we work together to reach the 6 development goals that tries to strengthen the WASH services. In Honduras, we use a system approach at a central level and at a national and municipal level. And for that, we apply strategies of advocacy, knowledge management, partnerships, and organizational development. In the video that I shared, we show how this approach of networking has been the trigger to strengthen the WASH system in Honduras currently during the pandemic, during this emergency. Therefore, we can say that on that video, we showed that the pandemic brought about new challenges in the WASH sector, especially those that are connected with the quality and the coverage of services. And even before the pandemic, these were efficient, and now we have new challenges because the pandemic has brought about some financial issues to the service providers and of access to the products so they can implement their functions. This networking approach fostered by the movement brought about the activation of the emergency task force in the WASH sector to be able to jointly develop a plan of response of the sector before the epidemic. Actually, this is a plan, is a guideline for the stakeholders, and this plan has been shared with the central government so they can get to know better what we needed to do and the level of support that is needed at a central level and at the level of the communities. Unfortunately, the response of the high level of the government was not so favorable. Therefore, the movement has mobilized its partners and collaborators to start working and not just wait for the central government to provide all the support we need. So on that video, we saw how the movement takes action at a central level of advocacy to bring about changes and improvements in the responses. But we've also been working at the level of communities and municipalities to be able to provide the responses they need. However, we have some questions. Will we get the support at time to be able to prevent the blocking of the services in the communities? Will that support be enough to bring about the structural changes we require in the WASH sector facing this emergency? But after the emergency, will we have the capacities to be able to continue with and prevent new disasters? So this is the big question we have. And this is what we show in this video. Thank you very much.
Great. Thank you so much, Martín. Unfortunately, Yogesh cannot be online just at the moment. I think he's having some technical challenges, so we will return to Yogesh as soon as he can join us. Also, could I request to our speakers that they always remember to mute when they're not speaking and unmute, obviously for when I ask you to come online. I know it can be a bit of a challenge, and in fact last time I left myself on mute for 30 seconds, so we'll try. Okay, thank you. And also I think one of the questions that's really been important, I think, in all the videos was around this question about how to really move forward now that we're starting to understand what the response requirements are for COVID-19. So first, some of the questions that came in from the audience, and thank you for submitting those, was around institutional arrangements and these coordination mechanisms that a couple of you mentioned. So first, thinking about how the coordination can work, and especially in this context, I have a couple of questions for Kate and then Martin on this topic of institutional arrangements and coordination structures. So Kate, coming to you first, the task force sounds really impressive. And was this the first kind of crisis that had this type of multi-sector task force assembled for? And if so, why do you think they were able to come together so quickly?
Thank you. Thank you very much for that question. Kamwenge, as a district, has hosted refugees before. I think that can be a crisis maybe that is similar to what is now happening. It was refugees from Congo, and Ebola is one of the diseases that has been rampant. Okay, they've always been on alert for Ebola. But what used to happen, the health department would always shoulder everything. So with COVID-19, it was really the first time they were coming together as multi-stakeholders. And the beauty was with it was that they used an existing multi-stakeholder platform. And the one that was existing was the District Water and Sanitation Coordination Committee. In the last 3 or 4 years that Water for Poor has been building capacity and providing technical assistance to it, it has grown from about just 2 or 3 departments to having all the departments actually represented. So it was, with COVID-19, it was timely to, call this same platform that included water, health, education, natural resources, and all the non-government organizations that are actually working. In the last year, the district has been working on signing memorandum of understanding with implementing partners. And so it was actually quite easy for them to look at what they were planning to do with the district and come in to support the action plan that the district has.
That's great, thank you. So really building on this existing platform and putting it to new use, and yes, coordinating with the clear roles and responsibilities, as you mentioned. Great, yeah. Okay, thank you. So then building on that, I'd like to come to Martín, because in your video, and a question that came in for you was that you mentioned that the campaign, or your movement had reactivated the WASH Emergency Working Group. So a question, first of all, is why did it go away in the first place? Did it exist and then be deactivated? Did they run out of funds? So just wondered how was that group reactivated? What was the process there? So over to you, Martín. Thank you.
Yeah, La mesa de emergencias ya tiene varios.
This emergency working group has been working for a number of years. Honduras is one of the most vulnerable countries facing natural disasters. And we had a great disaster around 20 years ago. And this platform was established in 2015, and it was based on a pre-existing platform of coordination in the sector. And this movement has been working since 2012, and it has a number of stakeholders, and we coordinate ourselves for emergencies and also for other actions. However, this working group has not been working permanently. It is only activated when somebody calls us, or especially when UNICEF calls us. Unfortunately, we hadn't held meetings for almost a year. And so this working group didn't have any kind of permanent communication once the emergency came up and progressed. And after a couple of weeks, the movement saw that the coordinators of the working group were not called by the UNICEF to activate and to do something about that. So that is how the movement talked to each other and put some pressure on UNICEF to be able to make this call and to get to work. And it was reactivated because new members joined the group. It had an initial group of partners, and there was a legal group and a legal statement that did not allow other members to come into the group. And this was not useful at a time of emergency. This is something we needed. So that is how the working group came back to action, and the movement brought new members to the group, including one of the service providers, because we began to do an emergency plan. And for the movement, it wasn't clear why we didn't have the voices of those that were facing the crisis directly. I mean, the service providers.
Great, no, thank you so much. So I think you're right, all this around who can participate and how, and having the structures in place from the beginning is clearly very important, and was in your case as well, and in your context in Honduras. So thank you both for those. Just to highlight to the audience, we also now have Yogesh with us from Nepal. So I'm just going to ask Yogesh to introduce himself and provide his 2-minute overview of his video presentation as well, which really focused on the COVID response that Helvetas has been conducting there. So Yogesh, if you would like to unmute your mic and give us your 2-minute overview, welcome, and we look forward to hearing from you.
Thank you very much. First of all, I am sorry that I am a bit late. At the last moment, I had some problem with connection. As you have said, my name is Yogesh Pant. I am working with Integrated Water Resources Management Program of Helvetas, Nepal. Namaste, good morning, good afternoon, good evening. I hope you have watched my video where I have briefly explained what Integrated Water Resources Management Program of Helvetas, Nepal is doing during the time of this COVID-19 pandemic. This program supports strengthening wash system and improve wash services in its working areas. As the entire world is suffering from COVID-19, Nepal is not exception to this. Given the situation, the program has now focused more on COVID-19 response. We have been carrying out COVID awareness campaigns through radios and different other means. We have been supporting installation of hand washing station in different public institutions like municipalities, rural municipality offices, health posts, schools, and other government offices. Similarly, we have been also distributing protection and sanitation materials like sanitizers, hand washing soaps, hand washing buckets, PPE, gloves, etc. All these are important measures to prevent spread of COVID-19. So this should be integrated into the WAS system now. Moreover, we should focus on enhancing capacity and entrepreneurship at the local level. We think that is the new normal. COVID-19 will be there for quite some time, so we need to learn to live with it and accordingly adapt our activities. That's all. Thank you.
Great. Thank you so much, Yogesh. And thank you for joining us. Even if it's a little bit late, we're delighted to see you. And so just to tell you a little bit more about where we are so far, we've taken some of the questions that were submitted in advance of the call today and have started asking the panelists those questions. But of course, the audience who are online with us are also going to ask some more questions, and they are being submitted through the question and answer box, the Q&A box. So for audience members, if you've not seen it already, please submit your questions there. And for speakers who are waiting to speak, if you see a particular question in that Q&A box that you feel you already want to start answering, then you can start to answer that as well. So we will hopefully come to those questions after a short time as well. So that's where we are at the moment. So coming on to some of the next questions that were submitted. It felt that there were quite a few questions related to how you can adapt plans during this time of COVID-19. If there's an existing master plan, how is it being used? How can it be adapted? How is service delivery happening? And how is monitoring happening in this context? How can all these different activities that we see as some of the building blocks of system strengthening approach actually all be done? So this time round, I actually have a couple of questions for Avo and Rodolphe, and then Yogesh on this planning, service delivery and monitoring process. So first of all, for Avo and Rodolphe, you mentioned in your video that the monitoring, planning, funding cycle was necessarily shorter during this time of crisis management. And so there are two questions related to this. You may want to take one each, perhaps, so we can hear both of your voices. So the first question, an audience member said they liked the idea of avoiding having a perfect plan, which was what you mentioned in your video. Were there models from previous emergencies or health crises that were readily available, or did you have to start from the beginning with this? So how did you actually manage this planning process? What could you build on? So that's the first question, which one of you might want to address. Then secondly, the other question, could you tell us a little bit more about the simple, flexible monitoring system that you used? Was this led by government, or was it specific to the Rano Wash program? So those two questions for you there. So whichever would like to take the mic first, please do go ahead.
Merci beaucoup pour les questions.
Thank you very much for this question. So first of all, when it comes to the plan, so in the context of COVID-19, so let me start with the normal. In normal times, we tend to have plans that seem to be perfect so that we can implement. But of course, in the context of COVID-19, we have a weekly meeting with all the different actors involved in the COVID response, and we talk about the needs depending on the different regions. And also there's a different tools that are provided by WASH UNICEF that we adapt in Madagascar so that we can inform our plans on these. And we were able to use these models, use these tools without needing necessarily to sit and reflect on a perfect plan, so to speak. So within a few weeks, I mean, in a few weeks even, we could really have regional plans that were bringing clear results, and so the timeline was also stipulated in the plan. So in terms of the previous experiences, it was not really related, but it was really based on smaller models that were already happening here in Madagascar, so smaller interventions. I would like to add something here. So in the normal times, when we plan, we try to really find solutions, we question the different solutions, the different possibilities, so we didn't have much time. So everyone really had to jump on board and decide what would be the solutions that we would implement now. So everything happened very fast. And you could see that in 2 or 3 weeks, there were already some changes. So we really had to act fast. And I think it kind of happened almost easier as opposed to spending 2 or 3 months for a plan. And oftentimes, we see that even these plans sometimes are not so easy to implement because there's technical jargon and there's a lot of unpacking to do on these so-called perfect plan. So I think we could learn from this COVID situation when we proceed with designing plans for the future. When it comes to the monitoring and evaluation system, I think we need to have a system that's managed either by the external or internal. But in our case, we have an M&E system that is geared towards results. And we have this with the government, with the UNICEF, with WASH, and each of these 3 levels had their own expertise and their own technical capabilities. So it was really an adaptation of these 3 levels, and it was a collaborative work. What's unfortunate is that it's not yet integrated fully in the health and sanitation department in Madagascar. But we wish for these 3 organizations to work together so that we can have an M&E system that can be more user-friendly. When I speak about user-friendly, what I mean is that we cannot satisfy everyone in terms of the indicators that we would use, the scope, the parameters, but we had agreed that we would work on some simple indicators that would allow us to really highlight the different activities, the different responses, and to also be able to measure the changes that would have happened in terms of WASH. So there was UNICEF that provided 5 indicators, for example, and as we carried on, we saw we don't have a perfect system. So with our Excel spreadsheets, for example, we could follow and track the evolution of our response. We could develop new small responses, and we could really have an idea of what are the progresses. So one of the advantages for that is that at each meeting and each discussion we had with the different partners, we heard what are the needs, and we could really see how we can adapt, how we can change in terms of the systems we were using, and we could see the results within a very short space of time. Thank you. I would like to add, when it comes to the simple M&E system, the monitoring and evaluation, first of all, there is the issue of the data and the use of the structures that already exist. And I think that one of the strengths of the WASH system in Madagascar is the collaboration that already exists amongst the actors, whether it's regional, local, or national. So it is easier to actually bring data from the bottom up because we previously used the M&E system to really be able to do a monitoring of what's happening. And it was easier because the structures were already there. and we could really share data, share the information. And also what was very important is the visualization of data. We had maps, we had diagram, graphs that are available from WASH, and all the partners can go on the website and comment until the next meeting that happens on a weekly basis. Another point that I would like to add, the benefit of the collaboration between the ministry, UNICEF, and WASH Madagascar is that this is something contemporary during the different crises we go through. And every time there's a crisis, we relaunch, if you like, this initiative. So in the ministry, we will not necessarily see the same system being used, and even between crises, for example. So we need to find a way to see how we can work together so that the monitoring and evaluation system be included and be mainstreamed really in the national sector.
That's great for that. Thank you, Rodolphe. I was just about to ask that follow-on question, so I'm pleased you've reflected on how it is taken forward and combined with other systems. So thank you. Very good insights there on how the collaboration between the different organizations worked and how you selected specific indicators each to be able to monitor during this time. So I've noticed some key points you raised there. And next I'd like to come to Yogesh. A similar question really about this interface between the planning, service delivery and monitoring, because on your video, one of our audience members noted that you know, the official WASH coverage number, as you highlighted, for sanitation is now at 100%, or at least ODF, you know, it's open defecation free. And so does this pose a challenge when working with government officials on trying to ensure that there are new or sustained services? That is, if the official numbers say there is already 100% coverage, why would they spend more time and money on planning, delivering and then monitoring any additional services if their services are already there? So hopefully that's not too sensitive a question to ask in this forum, but if you would like to give us some insights on that, Yogesh, we will be pleased to hear them.
Thank you, Tracy. A really good question. Not sensitive one, yeah. I'm not sure whether you notice in my video the coverage data that is provided by the government, the coverage and the functionality data. And government itself realized that there is gap between coverage and functionality. So as per the data provided by the government, some 1/3 of the projects, drinking water supply projects, they are not functioning properly. They are not functioning to their desired capacity. Similarly, about the sanitation, this 100% is the data on the day the country was declared open defecation free area. It was in September 2019. So by definition, I think I don't need to say much about this, the concept of open defecation free. So when the country is declared open defecation free, all the people in the country have access to toilets, might it be their own or the public or the shared ones. They don't defecate in open. So at that time, all the people, they had access to toilets. And it was the entry point of our total sanitation journey. It was a nationwide campaign, this open defecation free campaign, led by the government, supported by different agencies, celebrities, political parties, and people from different walks of life. So the main purpose of this campaign was to make the people realize the need of toilet, not to defecate in open, defecate in some particular place or in the toilet. So at that time, our full concern was to make the people realize it and construct toilet, irrespective of its standard, though the government had provided some standard, but not all the people, as you know, in the country like Nepal, a developing country, not all the people can afford toilet as per that standard. So they constructed toilets anyway on that particular day, you know, by that time. But these toilets, all of them, they are not of the permanent nature. They are very temporary one. And maybe by this time, many of them are not in use or not usable. So this is the issues. And government has well realized these issues, and it has reflected these facts in its different reports, reviews, and policy papers. And it is asking all the agencies now to support, address this issue, you know, to upgrade these toilets, to support, construct enough that the public toilets, to improve the quality of these toilets. So now the government is asking to all the agencies. We are working with the government. So this is not the blame game, you know, this is the reality. Yes, at the time when we declared our country, 100% people, they had access to toilet and they didn't defecate it open. And we have to keep on working on it, improving the sanitation facilities in the country. So this is the fact. Is it clear, Tracy?
Sorry, left myself on mute. Yes, that's great. No, thank you, Yogesh, and for the update and clarification. And so we're getting some questions coming through on the Q&A. And so I think maybe if we can just look at a couple of those. I do also have some additional questions that were submitted beforehand, but let's take some from the Q&A, as several have been upvoted by our audience members. So the first question that I'd like to pose to our speakers, and I'll come to a specific speaker. I see that Avo is going to answer the first one, but from Agnes Montenegro, she asks, to what extent has the crisis enabled to strengthen the collaboration between the WASH and the health sector? And in case collaboration has been strengthened, is it something that you would expect to continue beyond the crisis? So Avo, I've noted that you are happy to answer this question, so I'd like to come to you first, please.
Okay, RANWASH is promoting private sector engagement in Madagascar, and we are working with private operators to manage water services. They are at the same time the builder. They contribute to the investment of the infrastructure, and they ensure the management of the water services. In this water system, we have electrochlorinator to ensure the treatment of water of the system. So the private operators produce chlorine for the water system. During the COVID crisis, health centers need the disinfection product to ensure the hygiene at the health center. So they are working, we are beginning supporting these private operators to work with health centers and with school to have access to this product. So this is one experience here in Madagascar within the COVID, how the health sector and the WASH sector work together.
Great, thank you so much. Thank you, Avo, and for speaking to us in English, which was perfect and beautiful as well. So thank you for that example. I'd also like to ask Kate this question, because I understand in the case of the Ugandan task force in Kamwenge, that also was a very cross-departmental, cross-organizational setup. So could you tell us a little bit more about how working with the health sector and indeed others that you felt were important in this collaboration really could be strengthened beyond this particular crisis?
Yeah, thank you. Yes, in Kamwenge, the health sector was very instrumental, especially with their skills, especially technical skills, and the disease, when it came to the disease. So they were very critical, especially in the radio shows, going out to their community, even at places where they fetch water from. They really came in handy with a task force. But also when it came to surveillance, they were also critical in that they could actually do work as a team. The sector that was quite also helpful in addition was the security, because when it came to enforcement, they came in quite handy, because where sensitization of the community members, especially on distancing, and in handy if the health sector maybe the health professionals maybe were not able to explain all that to their communities. But yeah, there was a lot of cross learnings from both WASH, while WASH focused a lot on the preventive issues. Yeah, the health sector also came in quite handy when it came to case management within the district. Yeah, that's all I have to say.
Thank you, Kate. And I think your case particularly shows this value of the multi-stakeholder and multi-departmental approach. And so for those who may not have seen Kate's video yet, do recommend that you go and hear more about that case in Kamwenge district. Okay, so looking at some of the other questions that have come in, the next one, the one that's been voted up, is from Jan Maloney, our colleague who spoke to us last time. So this is a question he asked to all panelists, but I will just come to a couple of you. As COVID-19 is not going to leave us anytime soon, would you think that ad hoc coordination mechanisms are the best option moving forward, or rather pre-existing regular mechanisms? I know we heard from Kate already to say that in the task force in Uganda, that was building on an existing mechanism that could be deployed again. And we also heard from Martín about how it worked there. So perhaps, Yogesh, I'd like to ask this question to you. How can these coordination mechanisms work if it can potentially replace pre-existing mechanisms? Or how has it been working in the case of Nepal?
In the case of Nepal, we have already been working with the local government, municipalities, rural municipalities. So I don't think there is need to create another coordination mechanism, because the local government is responsible for coordinating with all the agencies, coordinating all these deployment activities. So we need to rather engage more with this local government. And similarly, we should capacitate these local governments and other local NGOs, agencies, which we have been doing since a long time. So our impression is that we don't need to create another mechanism. Rather, we need to strengthen with whom we have been working so far.
Great, thank you so much, Yogesh. And next I'd like to come to Martín on this same question, and then I'll have a second question for you as well, which has been upvoted on the Q&A. But Martín, what do you think about this question about ad hoc relationships or building on existing relationships?
Bueno, nuestra experiencia es...
Well, according to our experience, we need to make the most of the existing relationships, the existing platforms. One of the issues is that many times we try to build new structures at a local and national level. When a new issue comes to our society, I think the first step is to make a diagnosis of the stakeholders, the existing platforms, and how to make the most of that, how to make the most of that long expertise of relationships, because these relationships took some time to build, and they are built on trust, and these relationships have been working in other situations. So I think that this should be the first step. If there are no existing structures, we need to take a look at the dynamics that society has to be able to make the most of that dynamics and to build strong platforms, but platforms that are established on the trust relationships of other existing bases. We are social agents, and as such, we are always working with platforms, with different networks in different ways. So we are social beings. Therefore, these social relationships and collaborative solutions and relationships are existing. We just need to find them out and to strengthen that. In Honduras, we have a long history of this kind of platforms and structures. So what is difficult is to maintain that, the financial and operational sustainability of those platforms over time. But I think that this is feasible if there is engagement and if the stakeholders believe that there is a reason behind working together.
Great, no, thank you so much for that. And actually, it's a related question, well, possibly related, about the financing and continuation of these platforms over time. But there's a question for you specifically from Nash on the Q&A, which asks, how can you structure your advocacy to be self-reinforcing as a process that is ensuring responses from government are on time rather than as a one-off exercise? So I know you mentioned about this continuity of these platforms, but is that something that could contribute to this advocacy activities, or how can you make it more self-reinforcing over time? So if you'd like to also take that question while we have you, please, Martín.
Well, I think that the main challenge of working with the government is the changes in the government. Every 4 years, there's a change in the government, new structures, new stakeholders, map new trends at a local and municipal level and at the level of the central government. And one of the main points of the platforms is that they should integrate the government stakeholders in the platforms. This is the first stage of advocacy, the dialogue group between the civil society, the academia, and the governments. Once the presence of the government is institutionalized in the platforms, once the government changes, the new stakeholders are invited to become integrated into this new process. And then the civil society makes the institutional memory of those platforms. That is why the platforms should actively join the new stakeholders from the civil society and from the government to be able to work together. So this dialogue of advocacy is permanent. The first level of advocacy was that this movement came up as a network of NGOs. And the first point of the movement was this cannot happen. The government has to be there, and the government should lead this type of movements. So these were the first actions. At present, all the sectorial institutionalization of the government is part of the platform, but the issue we have today is that they don't have a high level of influence in financing or in the high-level policies of the government. So we have reached a boundary there. So currently, before the pandemic, the government should be prioritizing the sector. This prioritization should be institutionalized, and the Sustainable Development Goal C should be included as a priority on the agenda of the government of sustainable development for 2030. But one thing is to see that integrated into a plan or a policy, and another thing is to make that operational and to provide the funds to implement it. So this is our current dilemma in this emergency. We did this advocacy, and the president in April made a statement and he said that he was going to prioritize the wash sector during the pandemic. But this is a statement of the president that has not happened yet. No precise facts have happened. We have not seen a transformation of the sector. So that is why now we are focusing on our advocacy on the National Congress, not only towards the executive power, because we need to set up a decree of the National Congress to institutionalize this prioritization of the sector, so it can have a stronger basis of action on the advocacy actions.
That's great. Thank you so much, Martin. And I noticed as well here that actually, Rodolphe, you wanted to contribute something as well to this question asked by Jan in the Q&A. Would you like to take the mic and add to this one?
Ok, merci. Oui, je voulais répondre à la question.
Thank you.
I wanted to answer the question, do we need to use a structure, an ad hoc structure, to respond to the COVID situation and to have a longer lasting structure for beyond COVID-19? And for Madagascar, is that the COVID situation is quite generalized, I think, over the territory, and touching various regions at the same time, and everyone had to work on the problem, and we couldn't continue our normal habitual activities as we did in the past. So I think within the cluster in Madagascar, we have various catastrophes every year, such as cyclones, etc. But it was really the first time that we had development partners as well, who were part of the WASH cluster and who were questioning the practices that we had, and who were assisting us in order to make them more sustainable. When we develop activities, implementing activities for services, and it is the system we have put in place is sustainable, longer lasting, and there were lots of discussions as well. There were discussions on the constitution, the composition of the cluster, and coordination. And in Madagascar, there were various coordination platforms, and when the crisis came, when COVID arrived on a national level, and the national WASH sector, we have had various participants who collaborated together to coordinate the different actors, and normally we had some actors who supplemented all of the activities from the government, and to work on the local level with the different institutions as well. And given that the sector needed to be strengthened, but of course, regionally speaking as well, it was our regional coordination structures that were mobilized to bring together various actors, people who work in emergency situations, who can provide solutions and propositions, and who can actually make the interventions long-lasting and sustainable after COVID-19. Do we need, therefore, to review the coordination structures of actors in normal times as well, so that it can also be used within situations, crises, etc., so that many more structures can work in parallel? And in this kind of structure, we then, or discussion rather, we realize that it's a good idea to have a permanent structure to ensure continuity with regard of the various activities that can be used within normal circumstances and also in emergency situations, and to bring these situations, all these interventions together, responses together, so that we can strengthen and progressively develop the sector, and that we therefore can also reach the SDGs. Thank you very much.
That's great. Thank you so much. I know we only have about 10 minutes left, but there is a question here that Kate has offered to answer. So we can do that before we hear from the, well, for the rest of the discussion today. But the question from John that came in on the Q&A, John Brogan, says, have any countries seen a strengthening of systems for WASH in healthcare facilities in the new norm? Has there been an increased collaboration within WASH communities of practice on infection prevention and control programming in healthcare facilities? So Kate, I notice you'd be happy to answer this question. Please take the mic.
Yeah, thank you for that question. Yeah, actually in my video, I mentioned it a bit on WASH in healthcare facilities. Yeah, in the new norm, we are seeing a lot of accumulation of waste. So we've been promoting the issue of waste management in healthcare facilities. So this is something that we needed to prioritize and come in when it came to identifying which programs to focus on. Having incinerators on site was something that the district local government was keen on doing resource mobilization for. The issue of water, all of a sudden, there's great use of water in the healthcare facilities. So ensuring that healthcare facilities have their bills paid up front was something that came in handy. Actually, Water for People did support in paying some utility bills for some of the healthcare facilities. And then when it came to hand washing facilities, many partners were coming up with hand washing facilities. But we needed to provide technical assistance to these healthcare facilities to ensure that they are placed in areas where there's very high contact, especially with the patients. So placing them in the doctors' areas or waiting areas was very critical. And of course, training, building capacities of the support staff to ensure that the hand washing facilities are always filled up, and you know, that they're keen to clean up in those particular areas that really are very highly infectious. Yeah, thank you.
Thank you. So I see an additional point came in from Christina Nielsen on this, which mentioned that it seems a lot of actors are supporting temporary hand washing facilities in healthcare facilities. Why not permanent structures instead? Would you like to reflect on that as well, Kate?
Yeah, why not permanent? In terms of facilities, what I know in Kamwenge, there's been a lot of mind change around these facilities, looking at the design. The way most of the healthcare facilities were designed, they were not designed with permanent, for example, sinks, having sinks in a ward or so. So ensuring that we change the way facilities are designed, but also ensuring that we have piped water supply systems to many of these healthcare facilities is something that we have been advocating for. But all this comes at a cost, because they have to pay the bills and all that. So also looking at how they also plan for wash services for the healthcare facilities is also critical, because many of them think about maybe just drugs or more beds, but not so much on wash. So how can we get them to prioritize also wash, and then ensure that they plan and budget for it? It's something that is possible, but that is a long-term maybe solution.
Yes, I think that's right. And actually being able to even use this as an opportunity to talk more about infection prevention control and having hand washing facilities is a good starting point. But as you say, it's the longer term needs for ongoing design and access to water, payment of those water bills. So thank you so much. We're running out of time again today, and we still have a couple of questions in the Q&A box, but also some questions that were submitted in advance. So what I'll do is bring those questions together and we'll email our speakers about them, and we'll put any responses in a summary, a write-up, a summary of this event today. So thank you for submitting your questions in advance of today, and also this is to the audience in advance, and also for submitting your questions on the Q&A channel as well. You will see that some were answered as we went along, but if there are additional responses from our speakers, we'll add those too. So thank you all again. Next, I'd like to hand over to Alec, who's going to tell us a little bit more about the next steps for the learning exchange, and then we'll wrap up after that. So over to you, Alec.
Hi, thanks, Tracy. Thank you to all of our speakers. It was great hearing from you today. I just wanted to quickly, for those who are still in attendance, do a little poll, which I'm going to launch right now. So if you'll watch on your screens, I just want to know how it went today and how we did. I'll give you about 30 seconds if you can share your responses with me. Hopefully everyone is seeing that. Thank you. This is for the Secretariat to know how we're doing on these series, and there will be a survey going out tomorrow. So I hope you guys will provide us more feedback if you do have some to share with us. All right, about 2 more seconds. Thank you so much. And I think Susan has some slides to bring up for me. Just a few ways that our members can share with us. Okay, I'll do it. Here we go. So we do have the opportunity to share your resources on our webpage, specifically those related to this theme. If you have experiences or briefs, PowerPoints, blogs, we'd be happy to link to those on our sites. Also to let you know, if you have events around WASH systems or stories that you would like to tell, you are welcome, if you're on Twitter, to take over our account for the day. We do have over 13,000 followers. Thank you, Susan. And the last thing you can do is hold an interview with me. They take about 20 to 30 minutes. And those get posted on our website and shared via our newsletter with other system strengthening folks. And last but not least, the third and final, Susan, can you flip slide? There you go. The third and final theme in the series on the Systems Learning Exchange is recasting our systems boundaries post-COVID-19. This is going to take place, I believe, on September 2nd. Or sometime in the first week of September. Speakers will discuss how the COVID-19 pandemic will recast WASH systems thinking and practices going forward. We will specifically be looking at linkages with WASH systems and other systems, including health, agriculture, and climate and resilience planning. So I hope some of you will be able to join us. A reminder that you can follow along on our website, which is washagendaforchange.org/learn. There are tabs at the top of the page. So if you want to follow theme 3, please click the tab. We will also be hosting an event around World Water Week at home, which will be focused on WASH systems, resilience, and sustainability. So if you will subscribe to our mailing list, you will also be updated when that invitation goes out, which I believe registrations will start hopefully at the beginning of this week. We will also provide interpretation for that event, and we will have 3 different events across time zones. So we hope to include more people. And that's it. Thank you so much for joining us today. I think if Susan or Tracy want to take it from here.
Great. Thank you so much, Alex. Susan, did you want to add anything before we call it a day today?
No, just thanks to everyone for a great great discussion, and thanks for everybody who participated despite some of our technical challenges, and we look forward to seeing you at the next theme.
Great. Thanks, Susan. And thanks again to our interpreters and to you, Susan and William, for typing all the captions too. It's been a really good group effort today. So thanks to you all, and we'll share the recording of this webinar with subtitles in English, French and Spanish, and also a summary of the discussions on this second theme about adapting to the new normal. So that will also be available soon and in the 3 languages. Thank you to our audience, and goodbye until next time. Thank you. Bye-bye.